This animation describes how money flows within the NHS in England. This is the basic version. A more detailed version will be available soon. How public money is spent is determined by Parliament, and more specifically, the Chancellor of the Exchequer. The amount of money allocated to healthcare is determined by the Spending Review, which occurs roughly every 3 years, and amended twice a year by the Budget Report. The government department responsible for healthcare is the Department of Health, which has the largest amount of pre-allocated public money, with an annual budget for 2016-17 at £120 billion. From this money, the Department of Health has to fund NHS England, its own functions, as well as funding other bodies, including amongst others, NHS Improvement, who are responsible for overseeing foundation trusts and NHS trusts, as well as independent providers that provide NHS-funded care. The Care Quality Commission, who monitor, inspect and regulate health and social care services to ensure they meet quality and safety standards. Health Education England, who are responsible for the education and training of the healthcare workforce. And Public Health England, who oversee and provide funding for local authorities to provide health improvement programmes. NHS England is an independent body at arm's length from the government. Its main role is to set the priorities and direction of the NHS and to improve health and care outcomes for people in England. It receives the majority of the Department of Health budget, with funding for 2016-17 of £105.8 billion. NHS England is responsible for directly commissioning certain services, including military and veteran healthcare, prison healthcare, and also for specialised services which are commissioned on a national or regional scale to ensure that everyone has reasonable access to these services. There are 143 directly commissioned specialised services with a budget of roughly £13.8 billion. They are grouped into 6 programmes of care: internal medicine, which encompasses vascular surgery and renal dialysis and transplant; cancer care, which includes complex cancer surgery, radiotherapy and chemotherapy. The trauma programme incorporates amongst others neurosurgery and adult critical care, whilst women and children includes paediatric surgery, complex gynecology and fetal medicine. Blood and infection services features infectious diseases and bone marrow transplant, and mental health encompasses perinatal and child mental health, as well as forensic psychiatric services. The majority of NHS England's budget is allocated to clinical commissioning groups, which amounts to about £71.9 billion. These groups are clinically led and comprise mainly of GPs, but also include representatives from nursing, the public and hospital doctors. These clinical commissioning groups plan and commission services for their patients, including secondary or hospital care, which includes emergency and planned care, as well as paediatric and maternity services, mental health services, and community health services such as rehab services, health visitor and community nursing services. Since April 2015, primary care or GP services are co-commissioned by NHS England and clinical commissioning groups. So in summary, money flows from Parliament, via the Department of Health, to NHS England, who fund some services directly, but mostly allocate money to clinical commissioning groups, who commission services from the organisations that provide patient care. This animation was produced as a learning and teaching resource for the NHS Future Focused Finance and Clinical Educator Network. Please feel free to share and use this animation for teaching and training purposes. If you'd like a downloadable version, please contact us, and for more information see www.futurefocusedfinance.nhs.uk.